also want to underline what Supervisor Chavez was talking about in terms of a campaign, and I know it's part of the work plan, and I also would appreciate additional information. And since I'm talking about the work plan is missing the current California Department of Social Services that I'm just going to call CDSS from now on, and their feedback to us. So that is missing in the work plan, and that's a grave oversight. I love the slides that you all presented, the pillars that you have chosen. I don't think that it's being transparent. The state is asking us to improve in what we're doing, and I know that there's local efforts. I want to see the kind of energy coming from Dan, from you as a leader, Damien, from you as a leader, overzealous in what you're doing. And I don't see that. It's almost a year later. And we can pat ourselves on the back for meeting with the unions and making some slight changes, but I don't think it's enough. When 55% of the cases in voluntary family maintenance, we couldn't find, there weren't any safety plans for those kids. There was no formal protocol in place for social workers to follow up when the safety plan was not adhered by the family. So no, I don't think it's time to celebrate. This is not a celebration. And there's also this question that is lingering to me in terms of accountability. Who's accountable for where we are right now? James, Greta? You were county council. You were in administration. Dan, you were where Damien was. I've not heard yet a level of accountability for your leadership that places us where we are right now with our kids. And the concern that I have had and I have expressed, and I will ask you for an update around trauma bonding, is very, very unclear in your work plan where it's actually, what the results of that are. Because we also left children in homes that created risk for them. You know that. So what are you doing in order to mitigate that? Your system created that. Our system created that. What is it that you're doing to mitigate that? And I do want an answer. Damien, Dan, what are you doing? James, what are you doing? How are we mitigating the impacts of this extreme family preservation framework that put our children at risk, that created a death in our community, that continues to impact brown and black children? What is it that you're doing? How is your leadership changing in order for this to have a real reform? I'm tired of reading the same thing in the reports. So I do want a concrete answer. Let's start the conversation there. What is it in terms of your leadership that you're doing in order to undo what you did? You can only go as far as you've led.
Thank you, Supervisor. I think I would say the same thing now as I would have in December. when we first
Please
started having
don't.
these hearings.
I would really appreciate for you to say something slightly different than you did in December.
We want to
It
make
was
sure
very
that
disappointing.
we want to make sure that every decision we make for every child is the right decision for that child. So if
But
it's-
it wasn't,
if the
Dan.
child,
So I'm
if it-
asking you, what are you doing in order to correct your leadership to make sure that the systems don't fall back where they were, that compromised the well-being of our children?
Well, I think that the plan that Damien has outlined regarding implementation, making sure that we're doing structured decision-making correctly, making sure that we have policies and practices
Yeah,
that are
that
clear.
is all for social workers and frontline, but I'm asking for you as a leader. I'm asking you to be accountable.
And the accountability is to make sure we're following those state policies and the laws that are
Existed
outlined
before, and you weren't carrying them out. This is what I'm referring to in terms of this lack of accountability. You were in charge, Dan. How about acknowledging that to our community? How about acknowledging that we made a mistake in our system? You're going to apologize to each and every child that you put at risk, that didn't have a safety plan? What are you doing for that? Because, I'm going to guess where those children are going to come back. They're going to come back to our systems, in a juvenile justice system, and in our jails. So, James, what is it that you're asking your staff to do in order to lead us in a different direction?
I think that it's pretty clear that we've put very significant resources to address the concerns that have been raised by CDSS, the board, the community, and others.
It's not reflected even in the work plan. None of that feedback from the CDSS report is reflected in the work plan. That's lack of transparency and accountability, which is my problem from the very start, where you all didn't share a report with us for months and months until we had an expose with Mercury News, and then you were obligated to share it with us. We had no idea there was an investigation from the state on DFCS. Why isn't the CDSS feedback integrated into the work plan that you're presenting to us today?
I think we can go back and crosswalk the elements of the work plan here against the CDSS report and make sure that, to the extent that there are items that are not reflected in the work plan, that those are added to the work plan. It would make sense that they be fully integrated, and we will go and make sure that that happens with the updated work plan.
The system works as well as the people who run it. And sometimes we have to ask a question whether we have the right people on the bus to actually carry out the work that we need done for our community. This is almost a year later, and we're still not transparent about what the state is telling us to do. I don't know if you can understand my anger. I wasn't voted in, and I don't sacrifice my time and my children's time away from my family in order to just get along. I'm going to ask the very difficult questions. and I've asked them from you ahead of time. You don't want to give me answers? Well, then here we are. Does somebody have an answer about why we didn't integrate what CDSS report had to say to us?
Supervisor, if I may, I realize that I'm not Dan and I'm not Damien, and I'm a little bit of a late addition to this group, but I just wanted to say a few things about what you brought up. So I think you bring up a good point about the integrating the CDSS recommendations. I think the intention was that the items in the work plan responded to some of those recommendations, though did not directly call them out. And one thing we have been working on internally, it was not ready in time for this presentation, but is that crosswalk that James mentioned of comparing the CDSS recommendations directly to the items in the work plan and grouping them a different way. So rather than grouping them according to the work plan items, grouping them in sort of contingencies to the CDSS work plan, which I think, to your point, would lift up the recommendations from CDSS in a more clear fashion, and grouping those work plan items together, which I think is responsive to a concern you brought up, and also Supervisor Chavez, of having it grouped together in a way that I think is more understandable to the public. And I'm not an expert in child welfare. My engagement here is for other reasons, but I will say that I think that that's been helpful in that what we're trying to communicate sometimes is very complicated, and it's complicated to me, and I imagine to the public even more so. So making sure that it's very clear to you, to us, to a person who's picking up the report, what the state said, what their concerns are and were, and exactly how we're responding. It's something that we haven't had the final version, but we're happy to bring iterations forward informally, and also certainly for the board in the next quarterly report. The other item I just wanted to say is, I think it sounds to me, if I'm hearing you correctly, kind of what you're looking for is self-reflection of leadership and of DFCS and of the CEO. And I just want to say I think it's hard to capture that in a work plan, though I will say I think it has been happening. I think there has been deep engagement with what our philosophy is, what were we doing, how can we do it better. And you know, I personally was at DFCS not too long ago meeting with almost 200 social workers. I was with them for several hours, listening to their concerns, to their joy in their work, their difficulties in their work, what they would like to see us do better, how they would like to work with us to move forward. And it's been hard to get in those rooms sometimes. Getting social workers together in large groups is not an easy process. I apologize if that is not communicated properly in those reports. I do think that self-reflection is happening. I do think, and they would maybe not say this for themselves, but I see it happening in their leadership and in the way that they're acting and trying to engage with their staff. Though certainly more could be done, but I certainly think we can highlight some of those activities more forcefully in our reports and in that work plan, so it's more clear to you and others really the work that we're doing boots on the ground, which to an earlier point Supervisor Chavez made, we don't always do the best job about talking about ourselves and the work that we're really trying to do. And I think that that's a piece of feedback that is sitting on me, and certainly something I would attempt to do a better job at in the future.
I really appreciate that, Casey. I appreciate that you framed it around reflection. Yes, absolutely. But if we're going to reflect on what we've done in the past and what we're doing now, it's not any different. What you all did in the past was not share with the board exactly what was happening with the state, and that continues to happen. And so then I asked myself, maybe you as the point person in the administration are asking those questions, and I'm grateful for that, but is it happening with the remainder of the people who are the leaders in the everyday work of this system. And I don't have confidence. I truly don't have confidence, and I don't have the patience to see more brown and black children fail and be compromised. And I'm not going to be complicit. So if you all thought that you were doing 100%, I'm going to ask you to do 200. Because it's not rendering the kinds of results and the kind of authenticity that I would like to see in leadership. And I don't know if you understand how difficult it is for me to have to say this to all of you. I don't enjoy being the bad cop. But I will continue to ask questions. And I will do whatever I need to do in order to make sure that our children are receiving the kind of care and the kind of mitigated service to address what was done to them. This system did something to a cohort of children, and we are not recognizing it. And so I want to see that as part of this report. So if I have to force you to have that reflection, then so be it. I was really hoping it would be more authentically on your own. So tell me how you are going to, and this is going to be part of the motion to accept to receive these reports. How will you mitigate for some of what the State Department has addressed in their reports for the trauma and experience that our children had to endure because they had the strength and valor to tell somebody that they weren't safe, and the adults in their life didn't listen and said, actually, you're in a better place than anywhere else, and continue to be with those caregivers that put them at risk. So along with accepting this report, I'm going to ask you to bring me an off-agenda report on reflecting on the kind of leadership that will allow for us to grow this system. And I'm not referring to what do our contractors now say, our consultants now say we should do. I really want this to be your own personal reflection about your own role in this fiasco that we're in right now.